Welcome to Glow for Hope, sparking conversation on mental health, where we spark honest conversations about mental health, mental wellness, and hope. Every episode, we're breaking down barriers, sharing real stories, and opening up the dialogue about mental health. Because the first step toward change is simply starting the conversation. Whether you're here to listen, learn, or find connection in your own journey, you're in the right place. Let's talk about it. Let's spark change. This is Glow for Hope. Welcome to Glow for Hope, Spark Conversation on Mental Health, where we're lighting the way to open conversations and brighter futures.
We're your hosts. I'm Delisa Richardson.
And I'm Kelly Poelker. If you're new here, Glow for Hope is a nonprofit that creates safe spaces for real talk around mental health and suicide prevention. We do that through community events, education, and this podcast.
Now, this show is about conversation, connection, and community. We're not therapists. We're just two women who've been impacted by mental health challenges, and we're here to ask the questions, spark the dialogue, and hopefully to help you feel less alone.
And we are happy to welcome back Christina Kittstein. She was in our first episode, so if you haven't listened to that, go back and give it a listen. It's like full of all kinds of great information.
Yeah, that's a must. Now, Christina is a licensed clinical professional counselor and a board-certified art therapist with over 2 decades of experience. She's worked across the full mental health spectrum from inpatient to private practice, and she's known for integrating traditional talk therapies and expressive arts and evidence-based practices.
Her specialties include trauma and complex trauma. She's trained in cognitive behavioral therapy, dialectical behavior therapy, internal family systems, and EMDR, which she uses to help clients process deep emotional pain and reclaim a sense of peace.
Now, Christina is not only skilled clinically, she's also deeply compassionate, creative, and a fierce advocate for mental wellness. And you want to make sure that it's accessible, it's real, and it's human. Christina, welcome back to the show. We are so glad to have you. Your first episode blew us away, so we had to have you back.
Well, thank you so much for the invitation. I'm happy to be here.
Yeah, so today we're going to unpack the difference between a therapist, a counselor, a psychologist, and a psychiatrist, because nobody ever knows who to turn to for which or what they do, and so they don't do anything. So maybe we can help them decide what to do.
Absolutely. And I do appreciate saying, Delisa, earlier, that we really want this to be accessible. And I think in this day and age, it is getting more and more accessible than it's ever been for mental health help and support, and even just more conversations about it in general. But it's still scary when it's yourself or your family and you're already overwhelmed with whatever the stressors or the triggers are that are going on in your life that are triggering you to want to reach out for support, to then have to think, where do I start? Where do I go? Who do I call? Where do we go from here? So really the first thing that I would recommend is, if you have community and conversations already started within your own friends and family, a lot of times there are more people than you might even be aware of that already have been connected with doctors or therapists or people in the community and in the setting, and they can give some good personal recommendations. Anytime you're looking for a provider, there's not going to be one perfect provider for everybody. So it really does come down to trying to have some patience with yourself and some patience with the process, because the first provider that you get connected with might not be the best fit for you. And I always want to encourage people, don't give up, because there's so much help that exists and that you can be received. But we have to be able to show up and be in the process of getting the services.
I don't want to go down a rabbit hole here because I know we only have so much time, but there's also, the biggest thing is I don't need to talk to anyone.
Mm-hmm.
How do you get past that?
So that's a tough one, because the individual person who will be receiving the services really does need to be open to that, or nothing that is, things can be offered and presented, but the individual person has to be open to receiving it and take it in and be able to work with it. So when someone says, I don't need to talk to anybody, or I don't need that help, if it's your own child and you're the parent, there's a little bit more power and control in setting up an appointment and doing some encouraging of, let's just go meet this person, or let's just try this out, give it 1 or 2 or 3 sessions and let's see. If it's an adult who is just completely adamant against, I don't need any help and I don't want any help, then I would really just hope that the loved ones can rally around that person if they really see and believe that they need that help to just keep giving offers and suggestions. And sometimes it's extra scary to go straight to a psychiatrist or a therapist, because many people have the wrong assumption that means you're crazy, or there's something wrong with you, or you're bad. And that's just really not true. But it's hard to get through some of those assumptions if that's what an individual is believing. With younger kids, school-aged kids, there are school social workers and school nurses, and even for parents with kids in school, I would recommend connecting with that resource too. It's a really great place to start. School staff is usually there to work on school supports and school issues. So if there's bullying going on, the school social worker is going to address those things. If there's test anxiety, the school staff will help support those kinds of things. But school staff doesn't support as much. They'll try sometimes, but it's not their primary goal to work on if a student has depression or anxiety, and there's more supports and things that need to be, changes that need to be happening in the home, the school's not going to do that. But the school does often have resource lists of providers in the community to have just a place to start as well. But I think if you're struggling with any kind of stressors in life, there's no wrong or bad reason to contact a therapist or get some mental health help. Every human experiences emotions. We all have depression at times, anxiety, stress, overwhelm, burnout, those kinds of things. We don't have to have a formal diagnosis of major depressive disorder to benefit from services that a therapist or a doctor can provide. So many people are looking for help with improving communication skills, problem-solving skills, stress management, anger management,
conflict
resolution, all of those things. And those are services that are provided by therapists and counselors, and sometimes psychologists. Psychiatrists are medical doctors, and they write scripts for medication. Historically, early on, psychiatrists were the people that were providing more therapeutic kinds of interventions and would talk to their patients for an hour at a time. And that does not happen anymore in the days of managed care and insurances. If you have an appointment with a psychiatrist, it is primarily for the purpose of getting a medication. They are medical doctors. They write scripts. They schedule appointments for usually 10 or 15 minutes at a time. And you go in and follow up on, are you having any side effects? Do we need to increase that or decrease that or change that medication? And psychiatrists as medical doctors specialize in the mental health medications. Your general practitioners and primary care docs and pediatricians can also prescribe mental health medications. And for some of the more common antidepressants, anti-anxiety meds, those doctors feel very comfortable writing those scripts. And that is also a place that I recommend for anybody to start with your medical provider. If you're not feeling well, if you have some mental health concerns, talk to your doctor about it, and they can recommend the possibility of medication if they think that's necessary, but they also usually have some resource lists in their offices as well for therapists and counselors that they could refer.
Yeah, because shouldn't it work hand in hand? Like, you get the medication and stuff from the psychiatrist, but along with a therapist or a counselor that kind of helps.
And they should kind of also know what they should have they should be in touch.
Collaboration.
Yeah.
Yeah, that's the
Should.
word.
That would be amazing if it worked
wouldn't it be
that way
great?
all the time. And yes, the best outcomes are really to have all of the resources working together if you need all of the resources. Not everybody needs medication. I'm biased because I am a therapist, but I think everybody needs a therapist. Sometimes it's an absolute necessity, and sometimes it's more of a luxury and just part of a mental wellness plan that hopefully we did talk about some mental wellness plans in the first episode, but hopefully everybody has a mental wellness plan, and therapists are a really good component for those. Therapists and counselors are people that you would see maybe once a week, once every other week, once a month, depending on the severity of the struggles that you're experiencing or the issues that you have going on. And that is a place for more of that, like you get scheduled for an hour at a time and we talk about the conflict resolution or really it's the emotional IQ, emotional intelligence work happening there. We all as humans experience emotions that exist to give us messages, and our job is to receive the message from the emotion so that we gain that knowledge that can then fuel an action plan to help us reach our goals.
So are you using the term therapist and counselor interchangeably, or is there a distinct difference between the two?
So I do use them interchangeably sometimes, and there's a distinction as well. Counselors are more focused on the immediate, what is going on right now, and what are we going to do about it right now. So more of the solution-focused brief counseling concepts. And that is very helpful. It's very useful. The primary focus is more of the here and now. Therapists look at what's going on in the here and now and still will focus on here's what we're going to do about this right now, but then end up digging a little bit deeper as to how did you get where you are right now? What are the factors that are influencing you to be in this place to begin with, so that a lot more of the work then starts focusing on shifting some of those root causes of the issue.
So like getting to the traumas.
Absolutely.
Digging a little deeper.
Yes.
So when we're looking for someone, we're in the age of Dr. Google. Mm-hmm. So everyone gets on Google, and sometimes, Google is Google Analytics. It's what you're looking for. What pops up is kind of geared, whatever comes up first. So a lot of times when people, look in for someone in their area, the Psychology Today website will pop up first. And it can be a lot. How do you feel about that? And how would you kind of tell someone to know what they're looking for? Because it can be a lot trying to figure out, okay, who am I looking for? How do I get through this? And do you recommend even going that route?
Absolutely. So I think any avenue that is going to start that conversation or get you one name or number to call is a really good place to start. You can pull up Psychology Today. It's nationwide, so start looking into, your zip code and those kinds of things. I also recommend, if you have insurance, looking up your insurance provider list, because a lot of people want to use the benefit of their insurance and it makes the services more affordable. And especially if you're paying your monthly premium for the insurance and you want to use it, you would want to start with somebody that's already in your provider network.
And that'll be current, whereas maybe sometimes the website listing of who they say they cover, it may not be updated.
Sure.
Right?
And I don't know how often they do update those, or even if a therapist retired and they remember to take their name off of that list. And that's also why I would say ask around to friends and family and personal referrals, your medical doctor that you already see and have a good relationship with and trust, because it can be very overwhelming to get started. And unfortunately, a lot of providers have a long wait list. So psychiatrists for sure. If you're calling today to have your very first appointment with a psychiatrist, don't expect one for sooner than at least 3 months is usually the wait list, and maybe longer.
So what are you supposed to do during those 3 months?
Exactly.
There are some walk-ins that you could go to, right? If you're in, I know there's one in Maryville, I believe there's opened up that is a walk-in.
Centerpoint Hospital has a walk-in facility. That's relatively new. I think it's been about a year. But yes, that's an option. If it's a crisis, obviously 911 and the emergency room. But that's why it's also good to most people have a primary care doctor or a regular provider to stay in connection with them. Because if medications are necessary right away, you can always get started on that with your regular provider. And then not everybody needs a psychiatrist. Your primary care doc can prescribe meds for you. But if it gets to the point that nothing has really worked, or we need to add 2 or 3 together, the psychiatrist is always recommended at that point because that's their specialty. And that's, they have the most knowledge about that and have more comfort in when you have to make some of those combinations there. But it's not always needed. Even if you're taking medication, you still need therapy, because therapy is the time that we're really helping gain personal insight and awareness and understanding. If something changes in your body just because you swallowed a pill and you don't change any habits in your life, so I've been experiencing depression, but then I take this medicine so I don't feel as depressed. Okay, that's great that you don't feel as depressed, but have you changed anything else in your life, your lifestyle, your habits, your mental awareness? Are you now all of a sudden you took a pill for depression? That doesn't mean you know how to listen to your emotional messages and get the information and the knowledge that you need so you can create an action plan to reach a goal in your life. Like, that's what humans need to be doing.
Because it may also not be something that you need to be on long term. This could be a short, situational depression or grief or something that you've gone through. So you need to be in contact with a therapist or something in addition to your psychiatrist, so that they can both come together as your team and say, okay, maybe this bump is past and maybe we can get through this, wean off this medicine. Sometimes you can, sometimes you can't.
Right. And when you're doing the work to gain the personal insight and awareness, and you're clear about how to set your goals and how to use the emotional messages to fuel those action plans, and you're reaching those goals, you're thriving in this life. And when we have a really strong foundation of physical wellness that is impacting our mental wellness, and we're sleeping good and we're eating healthy and we're moving and we're thriving, we really don't need medications. A lot of people don't need medications a lot of the time under those situations.
Yeah. I totally lost my train of thought.
We haven't talked about psychologists yet.
Yeah, we haven't talked about those, but I'll have to come back to whatever my thought was, but go on and get into the psychologist one.
Okay.
That's okay.
So a lot of people come to me as a therapist and say, well, I kind of think I need medication. I don't know if I need medication. What's my diagnosis? Do I have a diagnosis? And therapists are qualified to give diagnoses. But personally, in my own practice, I focus more on looking at what are the symptoms that you're complaining about, what are the issues that you have, and let's focus on what the treatment plan is going to be. Because in my opinion, the DSM-5 is the Diagnostical and Statistical Manual of Mental Disorders, and they list depressive disorder and prolonged grief disorder and anxiety disorder and post-traumatic stress disorder. And these are all emotions. emotions are not disorders. So I have a little beef with that. But insurances require that everybody has a diagnosis to be able to give payment. But clinical psychologists are trained to do the testing, and they do a really, really great job of a wide variety of battery of testing to really get an appropriate diagnosis. So when a person is needing a diagnosis, whether it's for specific additional services for their children from school or just to be able to have a specific kind of medication, you're not going to get an antidepressant medication if you don't have a diagnosis of depression. But some providers will say, well, I'll just throw this medicine at you because you came in and said that you want it and that you feel depressed. And so I'm just going to write down that you're depressed. Okay, well, that's not necessarily an accurate diagnosis.
That probably happens way too often.
Yes. And there's a bunch of hubbub in the news about like ADHD. So my kid is struggling in school. Well, try this Ritalin. We'll just say he has ADHD, but did you do any testing? Do you have any documentation? How do you know if you really do have that or don't have that?
Right.
Psychologists are really good at that. That's their specialty. Therapists and counselors do not have the training and are not qualified for doing the testing. Psychologists do the testing. They also do provide some therapy. Like they'll see some of their clients a week at a weekly basis or every other week or whatever and provide therapy too. But they also could do that testing. Psychiatrists are the medical doctors that can prescribe meds. And again, you have to have a diagnosis to get a medication. So they will also give diagnoses. And I think they do a better job than a general practitioner for a diagnosis. But psychiatrists also are not going to spend the amount of time that it takes to do a full comprehensive battery of testing to, excuse me, to actually get an accurate diagnosis, to rule in this or to rule out that. So that's where the clinical psychologists really have their specialty, and they're a really nice bridge between a medical doctor, whether it's a psychiatrist or a general practitioner. If you're going to have, or if you're really needing medication, I recommend having the full battery of testing done through a psychologist so that you have a really clear understanding of what the diagnosis is and why, and what it's not and why, because that testing does that.
So that's like the first step?
But that also doesn't have to be the first step.
Okay.
I think the first step is just get connected. No matter how or where you get connected, get connected. If it's through the school resource, if it's through your church, if it's the phone number from a provider off of your insurance list, if it's somebody that your family or friend used that said, well, I went to this person or we talked to that person and they were pretty good. Just get started somewhere. And again, your medical doctor is a good place because you already have a relationship for the most part. Not necessarily that the medical doctors don't do therapy. They don't help you problem solve and learn new communication skills and conflict resolution and learn how to work with your emotions instead of ignoring them or burying them or having unhealthy defense mechanisms, things like that. That's what happens in therapy. But to get started with a provider, start with somebody that you already know or the path of least resistance so that you can at least get a phone number to get started.
I'll tell you a good resource, and this is actually where we're at. Glow for Hope is building kind of a provider list and putting in the geographical areas and stuff, but the Facebook communities, people are always looking for recommendations. And then I don't necessarily focus in on the ones that speak up and say, hey, I have openings, but it's the other ones that are commenting that, I had a great experience with this person, or, sometimes it's, I didn't have a great experience.
Sure.
And you have to pay attention to that too, because like so many other things, they're not all created equal.
Right.
And some it's a personal thing and it just don't click with the person or whatever. But some of them also have bad reputations. But it is a good resource, and it's some of those things that we're trying to pull out and just be able to provide and have a space to do it. But there are any of the local community Facebook groups are a good
Absolutely.
resource for that.
And some people are looking for extra support because of like a medical issue. I've gotten this medical diagnosis and I'm struggling because my body doesn't work the same as it used to. And so there will be support groups through Facebook and things like that will say, oh, this provider kind of specializes in this issue that we are all here because we all have this. And that can be really helpful too. And I appreciate you pointing out not everybody's created equal and not everybody's personalities are a good fit. It doesn't mean that it's a bad or incapable therapist or not a good client. Sometimes it's just not a great fit for the individual people. So I always encourage everybody, even when I'm meeting a new client for the first time, I'm like, look, if I'm not a good fit for you, it's okay. I might not be, but let me know and I'll help get you connected with somebody else because I'd rather you get service than drop out because something didn't go right or
for sure.
There's so much help that is available and I want everybody to be able to get help.
Yeah. That's the key.
Yes.
So let's dive into a little bit more on what you do specifically. That the art therapist has always intrigued me.
Sure.
So what does that do?
So art therapists, I have all of the same training and skills and knowledge base as a licensed clinical professional counselor, because I do have that license. But then on top of all of that education and training, the art therapy education and training as well, which is really about how do you use art and nonverbal means of communication for personal expression and understanding and insight. And it's definitely very helpful for kids, of course, because it's just naturally what many children we just naturally draw when we're developing as young children. As we grow into teenage years, we become less and less. If we're not naturally good at it or we aren't naturally interested in it, we start doing less of that. And by the time we're adults, again, unless we are
I can't draw a circle with a compass.
Unless we're consciously, mindfully holding ourselves accountable to building those skills and using that outlet, we're not very, we just don't use that outlet very often. But everybody is capable of being creative and making marks and using color and experimenting with different materials. So art therapy isn't about come in here and make a piece of art that you're going to take home and put in a frame and hang on your wall. It's not about the product of what's being made. It's more about the process of what is happening. So we're looking at, as an art therapist, depending on what the specific goals are, if we're working on building frustration tolerance for a certain individual, and naturally, they choose to do black and white drawings with Sharpie markers on paper. I might design or bring out the watercolor materials and a larger piece of paper so that they get the experience of working with a material that is much less controlled than a Sharpie marker. And on smaller paper with a Sharpie marker gives the individual using it a lot more control over the situation. A larger piece of paper with watercolor paints, there's a lot of things that are going to be outside of your control happening in the process of interacting with that medium. And while the person is working with that material during the session, you're going to experience likely frustration, but a variety of emotions in the moment while you're doing it, which is a really, really great time to then build in coping skills and learning opportunities. When you're feeling this, let's do these things so that we can calm your bodies, that we can be clear about how we're thinking, so we can have clear and rational thoughts about how we want to handle what happened on the paper. How does that individual cope with something not going their way? Do they get angry, frustrated, tear up the paper, quit? Do they say, oh, I really don't like how that looks and I wish it wouldn't have done that, but I'm just going to work with it and shift it this way and then add a line over here and add a color there. And then I think I love it anyway, even though it isn't how I expected it to be. And as a therapist, I can learn a lot more about an individual faster, being able to witness and be a part of the interaction of the person with the art material, than if they just come in and sit on the couch and we have a verbal conversation. Because especially by the time we're adults, we're really, really, really good at manipulating language. And sometimes we're even lying to our own selves and might not even realize it. And me as a provider meeting somebody new, I don't know if they're lying to me or not. Yeah. And I can only work with what they bring in. So the art and the creative expression and the interactions there bring more information for me to get to know them. It then can highlight them getting to know more about themselves. And the information is very real and it's very true, because unless you're a trained artist, you don't really know how to manipulate the art material. You don't know how to lie in there. So it's a really great resource and a wonderful opportunity to be able to work that in and build that into the coping and expressing and learning process.
So when people come to you or to any art therapist, do you go with the intention of the art therapy, or is there through, earlier sessions that you determine if they need the cognitive behavioral or if art therapy is going to be better, or
sure.
How do you?
Well, and we can choose to do art or not. We can't really, I haven't learned how, or I'm not good at, I don't think I can not do cognitive behavioral therapy even when doing art.
So explain what that is real quick.
Cognitive behavioral therapy is the understanding of how our thoughts and our emotions and our behaviors interact with the environment, and how what we are thinking influences and impacts our emotions, and how our thoughts plus our emotions motivate our behaviors, and then how our behaviors are influencing and affecting the environment and the world in which we live. And then that's where our triggers are happening and we receive consequences from our behaviors. And so like that cycle and that dynamic and the interactions of those things. And all of that is still relevant in connection to art itself and the process of doing art. So you can take the art out of therapy, but you can't take the cognitive behavioral therapy out of the art, really, because just in the processing of it, all of those pieces go together. Okay. Some people contact me specifically because I'm an art therapist and they know that about me and they are seeking out art therapy and they come for the purpose of that. A lot of people find my name in their insurance provider list and it doesn't say that I'm an art therapist in there. Insurance companies don't acknowledge the credential of it. So they don't have any idea that I'm an art therapist and they just get lucky and show up and I offer them art materials and and they're willing. But not all I don't use art in every one of my sessions with every one of my clients either. A lot of the clients that I have are really motivated to be there. They want to be there. They have specific goals they're working on. They're doing the work and the hour goes by so fast that there's not even enough time to talk about all the things they want to talk about, much less try to take time to do art too.
Right.
So we don't use art in some of those sessions, but occasionally when we're stuck, it's like, nothing seems to be changing, or I just still don't get this, or I've done all these things and I'm still really, really struggling with that. And I'm like, well, let's put some things on paper. Let's do some art. And then like, boom, there's some new information. Or, well, look at the connection in those relationships there from those different people that we were talking about, or those different situations. Did you ever think about putting them together? Because you put them together right there on your artwork. Did you ever think about putting them together in real life? Like how does the art relate to life, and how does life relate to the art, and what are the relationships of what's going on within the art, and how are you emotionally responding to the process of doing the art? Art can trigger the frustration if we're working on that as a goal and somebody is not doing anything, that's only doing the really safe things. We can I can encourage them to use materials that are going to create the frustration.
So
but
you do the watercolor and it all runs together. And
right. Didn't want those colors to mix. But it can also be the opposite too. Somebody can come in really angry and frustrated, and we can use art to help calm the body and relax the system. And I scribbled the first 3 pages, but then I was able to, create this. Watercolor is very relaxing for some people. You get a straw out and you just blow that water around in different designs and patterns. And so art can be used in a whole variety of different ways depending on the specific individual and the specific goals that are being worked on.
That's interesting. Now, you have one thing on here that I have never heard of, which isn't necessarily earth-shattering, but the dialectical behavior therapy. I was impressed I could even say that, but what is that?
Absolutely. So dialectical behavioral therapy is grown out of cognitive behavioral therapy as well. So it's a lot of the same basic tenets of that, but it's really respecting and highlighting and looking at helping clients tolerate the opposing forces of things. So even though this oftentimes in a client's words, this is all bad. Everything about my life is terrible. Mm-hmm. Even though this is all bad.
I hear that a lot.
Here are some things that are good. Or even though this good thing happened, there's also still this bad thing that is going on too. So how are we looking at those opposite components and opposing forces and working towards finding a middle balanced ground? And there's a lot of focus on mindfulness that is really weaved into the DBT work that traditionally cognitive behavior therapy kind of leaves out of the theory of it. DBT weaves more of that in. It was originally designed for helping individuals with bipolar or borderline personality disorder, and there's a lot of suicidality that gets embedded with borderline personality disorder. Mm-hmm. And so it's a highly researched form of treatment that helps reduce suicide ideation and actions and a lot of very specific coping skills and tools.
So when you go to a medical professional, is that the best way to kind of encompass all of them? I guess you go through a series of, you said you talked about testing, and then there's just regular talk before you actually kind of decide which direction to go to here, and then we haven't talked about EMDR either. That it's my understanding that that's a lot more trauma based and getting way back in the way back to what really is the cause of so much of my anxiety or depression or.
Sure. So EMDR is a technique that is used specifically for reprocessing trauma memories. That doesn't have to be anything from way back. That could be something that just the car accident that I had 3 weeks ago. Mm-hmm. EMDR is it stands for eye movement desensitization reprocessing. It's the act of re-experiencing a traumatic memory in a safe setting with a therapist with some tools. There's a tool called the TheraTapper that is what I use. Originally, it was used with eye movements, and that's a whole nother session in and of itself. But it's the process of helping the brain and the body reprocess the traumatic information so that it can be emotionally neutralized. Mm-hmm. Trauma gets defined as an experience that doesn't get processed on a timeline continuum. So when a memory gets triggered, we re-experience it as if it's happening now. So if I was in this car accident and my system really truly felt like I was going to die, and I didn't because I'm here talking about it, but it felt like it in that moment, and I felt the panic, and I was crying, and my hands were shaking, and my legs were seized up, and I hear brakes squealing outside, I can physically have that same reaction in my body in the moment right now today, even though the experience happened 3 weeks ago. That's how trauma is defined.
Mm-hmm.
It's not what the experience was, it's how our body processed it or got stuck in the loop of it. So EMDR is a technique that is used to reprocess that so that the body doesn't keep responding and reacting as if it's happening right now, so that the memory can actually be moved onto that timeline continuum, that it's remembered as something that happened in the past and not refelt as if it's happening right now. So that can happen. That can be any kind of a triggering memory from any time in life. That's a technique that's helpful.
And it's supposed to be like, okay, because you put it on this timeline continuum, that it's just not going to keep repeating itself to you because you get closure with it, or?
Correct. Yes.
Okay. A lot of people would argue that why would I want to bring up something that happened so long ago, or not even just that, but even in, in therapy in general, that why do I want to dig up all the bad stuff that's happened to me? And how is that going to help me to relive it? Or if they pushed it back so far, they just say, hey, I've dealt with it. I'm over it. I'm guilty of it.
Right.
And things. And
good question, because nobody would want to do that. And what I say to people, two separate things. So if we're talking about EMDR, truly trauma that you can, that you're having flashbacks about, and the loud noise out there can trigger it, and I can crawl under the table because my system believes that I'm in the war zone, even though I'm not, and it was just a loud noise outside. My maybe question back to them would be, you are already re-experiencing that trauma at any given day or time, that any one of probably lots of triggers are triggering that, and you're re-experiencing it beyond your control when you're not ready for it, when you haven't planned it at any given time. And you have kind of learned to cope, or you are kind of conditioned to that in the sense of you only drive certain ways around the neighborhood, or you only go certain places at certain times, or you just avoid the 4th of July celebrations always because there's always loud sounds, so you just don't ever go to a 4th of July celebration.
Right.
Why would you not want to, in a therapy session with a therapist that you've already built a trusting relationship with, reprocess that traumatic memory so that it actually goes in the past where it belongs? You don't re-experience it every time there's a trigger. And then you're free to drive any way you want in the neighborhood, to go anywhere you want at whatever time of the day, to participate in the 4th of July celebrations. Trauma really makes people's lives a lot smaller.
I think recognizing that it actually is a trauma is such a big thing. And
sure.
People, and do you want to be the one? Are you the one that points it out, or does it have to be a self-identified trauma? Or, trauma is different to different people. And, I came from a world of, I worked in a world with a lot of people that, they had traumas, and that's why they wrote their self-help books and this, that, and the other thing. And I would always be like, yeah, I just don't have that. I overcame this kind of thing. Have I had bad stuff happen in my life? Sure. But I feel like I've moved on from it. And, maybe there are some things that impact me in certain ways, but I just never looked at it as such a big thing.
And it can be either. It could be self-identified, and you could come in as, well, not everybody, you have to have special training to do EMDR for that process. So some people come in specifically because I saw that you provide EMDR and I'm here for EMDR. Mm-hmm. I have this trauma and this is what I want to work on. Perfect. Fine. Come on in. Sometimes just in getting to know a client and working on conflict resolution for something else. My spouse doesn't ever listen to me and we fight all the time and we can't communicate very well. And then it's like, oh, you keep having trauma responses in that dynamic, it sure sounds like, because you told me this other thing from when you were 20 or 10 or whatever, that maybe it isn't on their awareness at all that there was trauma, or that their current functioning and interactions is actually a response to that. So I will point that out, or kind of put that question on the table. Do you think this could be possible? So that could be either way. To the other comment, even if it's not trauma, to the question of why would I want to dig up anything that was uncomfortable, or just even if it's not trauma, just a yucky memory or a time frame in my life. And that also keeps some people away from therapy. I'm not going to therapy. They're going to make me talk about stuff that I don't like.
Exactly.
Or stuff I don't want to talk about. And a promise that I make to all of my clients, I would never, ever ask you to talk about anything that is uncomfortable, that you don't want to talk about, that you don't like, for the purpose of just reliving it to then feel worse when you leave my office. That makes no sense. And I would hope no therapist would ever, ever do that. That is not at all what therapy is about. My promise to my clients is, if we go back and revisit anything from the past for any reason, I would never ask you to do that unless we are already, like myself and my client together as a team, both very clear as to what it is we're looking for, or what knowledge we plan to gain from going back there to revisit it. The only reason to do that and to dredge it up or to recall something is to gain knowledge that we need for ourselves and our life right now in this moment, because we have a specific goal that we're working towards and we know what that goal is. And we need that knowledge, which knowledge is potential power, to do what? To fuel an action plan. The knowledge can fuel the action plan. The action plan is the action itself. That's what the power actually is. The action is the power to reach the goal. So in the process of therapy, we're discovering all of those pieces. We're creating those plans. And I would never say, oh, hi, and what is your name? Okay, great. Tell me about your traumas or your early childhood. And then you're just going to share those details and walk out crying? Right. Never. If anybody asks you to do that, just leave before you share the information, because that's not okay. If you don't know what we're doing and why we're doing it and the direction that we're going, then I'm not doing my job well.
Good stuff. Good stuff. Is there anything else that, as we kind of wrap up here, that you would want, to distinguish between them, or any other just advice or tips, or how do you select one? How do you select a therapist, a counselor? Is there some criteria that, a mental checklist to go through, or?
Sure. We'll talk about the criteria just in a second. One other thought that I had, many people's employers offer an EAP, which stands for Employee Assistance Program. And that is usually focused on more counseling. It's short-term, 3 sessions or maybe 5 sessions. But the employer has a contract with a company that hires therapists or counselors for short-term counseling support for the employee and their family members. So you could also, anybody who's trying to get connected with somebody can ask their employer as well if they have an EAP. And if so, that's a good place to get started. It's 100% free of charge to the employee. It doesn't go through their insurance. They don't have to pay a copay. They don't have to call their insurance company, get anything authorized. And
it's anonymous.
It's absolutely anonymous. So yeah, that's also another resource that's available to some people depending
I'm glad you brought that
on
up.
their employer.
I've been out of the corporate world for quite a while now, but we did have one before I left it.
Yes.
But that's a good point, sure.
And then in addition to that, I would say just read the therapist or the psychologist or the psychiatrist's bios, and they'll usually state what areas they specialize in and or what style they work with, what their theory base is, and or you're starting a relationship with another human being, whether it's a doctor, a therapist, a counselor, a psychologist, it doesn't really matter. They're still all humans, and we want it to be a good fit. And you would be interviewing them kind of the same as they would be interviewing you. So on the first phone call, if I don't answer my phone right at first, I'm in sessions and things like that, but I will call back, and before I schedule a person for their first session, I ask, what are your goals? What are you coming in for? What are you looking for? I want to make sure that my training is the best fit for them. And I explain to them as well, or even if I am not the best fit for somebody, if they want marriage counseling, I'm not a marriage therapist. I don't do that. So I'll give them some other referrals. But I do advise people to ask, what would I expect if on my first session with you, what should I expect? Mm-hmm. How long is it going to take? Cognitive behavior therapy, just kind of as part of the platform, usually gives homework, like go home and make this list, or go home and do this thing, or, follow up on this stuff at home. Strict psychotherapy, psychodynamic therapy would never give homework as a theory base, because that would create an opportunity for the client to let the therapist down, and it brings up can trigger a lot of emotional things for the client of not being good enough. So we're just going to take that component out of the theoretical base. It's not right or wrong. It's just different. But it's okay to ask the therapist, what would I expect? What is your theory base? What services do you provide? If you're looking for EMDR, do you provide EMDR or do you not provide EMDR? Those kinds of things. And you can kind of get a sense on the phone, even in a 10-minute phone conversation, if I feel comfortable talking to that person, if I got any of my questions answered.
Right.
Those kinds of things. Now, that's not always an option. I'm just an individual provider in my own private practice, so you will talk to me if you call me. If you're calling a community center or a community agency and they have 20 therapists on staff, they're going to have a secretary who answers the phone and is just going to plug you in with whoever has available. The next opening. But even with that, you can still ask the person who answers the phone. Mm-hmm. Usually the bigger agencies like that have all of the pictures and the bios of their therapists on their website too. And if you have flexibility with your schedule, always ask that. What is the therapist's flexibility? What is the individual person's flexibility? If you can take a midday appointment on a Wednesday, you're going to probably get in sooner than if you have to have a 6 o'clock on a Monday night. So
when everybody's off of work.
Yes.
Yep. One thing I want to go back to something you mentioned earlier, as far as so many times you hear people say when you're talking about stuff that's going on with you, well, yeah, but at least it's not as bad as XYZ. I learned a long time ago that it's like, you know what? Your stuff is your stuff. Doesn't matter what's happening to anybody else. It's your stuff. It's real to you. And it doesn't have to be discounted. I just had this conversation with somebody yesterday. You don't have to discount feeling bad or something being bad in your life.
Exactly. Comparison is the thief of joy.
Well, there you go. That about all sums it right up.
And no matter what you're feeling, and no matter how anybody else is feeling, your emotions are your own emotions. And whether it's a 1 on a scale of 0 to 10 or a 9 on a scale of 0 to 10 kind of doesn't really matter. The fact is, you are recognizing that you are experiencing an emotion. And emotions exist to give us messages that we need to survive in our life and to live and to thrive. So if you get into the habit of saying, okay, but my emotion is only a 1 or a 2, and that person's emotion is a 12 on a scale of 10, so theirs matters more, or has more value, or I I don't deserve to acknowledge my emotion because it's only a 2 is completely absurd and ridiculous. You still have an emotion that is at a level of a 2, which just means that you're really aware of that before it has gotten so intense that maybe it is showing up in a physical form, like a headache or a stomach ache or something else. And you still deserve to receive the message that your emotion exists to give to you, for you in your life so you can thrive.
And to be validated by others when they say that, not to say.
Absolutely.
And that's, I mean, I'm guilty of it. I'm sure you have probably, well, maybe you haven't because you're more aware of it. But, when you're trying to minimize something for a kid so that they're not getting so worked up about something, and or they're complaining about, they don't have an Xbox working today, and look at the people in the third world countries; they don't have half the things you do. Is that what you're really supposed to say to them, or what do you say?
Right, you say, "Wow, buddy, I can tell this is really hard for you right now." And what do you want to choose to do about that?
We don't have to bring in the third world country, or
nope. Your emotions matter always.
Yeah.
And you matter always. And I'm here to help you interpret those messages so that you can live your best life. Everybody
but then we're
deserves
growing
to thrive.
soft kids. I could sit here and go back and forth all the time because you know what I'm saying. We have to change the message that we're putting across to not just our kids or younger kids, but just to each other in general. Friends, neighbors, relatives, enemies, whatever.
Absolutely.
We have to change the dialogue.
Yes. And we're not growing soft kids. When you're growing children who are insightful and aware and know how to identify the emotions that they feel and receive the messages that they exist to give to them, they are strong and they are empowered because they set goals and they have appropriate action plans to reach the goals. And they do big things.
I love that. That's a great way to end today.
Thank you for having me.
It's been great. I appreciate you coming back. And again, if you haven't listened to the other episode with Christina on what exactly is mental health, go back and listen to that. But otherwise, we're going to wrap this up. And until next time, take a breath, take a beat, and remember, you're not alone. Most importantly, let's keep the conversation going.
Thank you.
Thanks. Thank you for joining us on Glow for Hope. If today's conversation resonated with you, share it with someone who needs to hear it. Remember, your mental wellness matters, and you are never alone. For more resources and support, visit glowforhopenfp.org. That's glowforhopenfp.org. Stay connected, stay hopeful, and keep the conversation going. Until next time, keep shining.
This podcast does not and is not intended to provide medical advice. The information presented on this podcast should not be interpreted or construed in any way as a replacement or substitution for medical advice. It is important that you discuss your condition, treatment options, or any questions that you may have with your doctor or healthcare provider.